Plantar fasciitis is a pain. Everyone that's been misfortunate enough to get it before will tell you. Normal everyday tasks we do like errands, cleaning the house, or taking the stairs at work gradually become things we'd rather avoid due to how severe the subsequent heel pain can get. But what exactly is happening in the condition? How is it brought on? And what is the best way to go about helping it? Well, we've got your answers. But first, as always, please take note of our disclaimer. The plantar fascia itself is a fibrous, ligament-like structure that originates from the inner part of the calcaneus, also known as a heel bone, and inserts into the forefoot. It plays a key role in the normal biomechanics of the foot, and provides support for the foot arch, protection for the deeper structures of the foot, alongside shock absorption. Plantar fasciitis is when the origin of the fascia becomes irritated. Often, pain is worse in the morning, gets better as the day progresses, but then worsens again later in the evening. If you're wondering what the link between the time of the day and pain severity is, for the morning, it's because your foot's unloaded during sleep, and as a result, the plantar fascia shortens as it relaxes. So when you get up, apply new load to it, the plantar fascia has to stretch back again suddenly to help manage that load. Then the irritated area undergoes a lot more tension than usual, causing worse pain. As the day progresses and the plantar fascia lengthens and adjusts, the region's tension gradually subsides so pain improves. But then, in the evenings, the pain severity circles back around again from the accumulative load and tension that builds up from all the walking and standing necessary to go about our daily business. Moreover, it's worth pointing out that the name plantar fasciitis can be quite misleading. Itis is usually the suffix added to conditions like arthritis, colonitis, bronchitis, etc., where inflammation is present since the word means inflamed. Yet there's actually no inflammatory cells present with the condition. Because of this, there has been some talk of renaming the condition, but at the time of making this video, the name remains. There's many reasons suggested for how it may arise. These include reduced mobility and/or strength in the region, leg length discrepancy, improper footwear, an arch that is too high or too low, diabetes, and an elevated BMI. In fact, one study estimates that people with a BMI of over 30 are almost 6 times as likely to develop the condition as those with a normal BMI. Yet the most common cause is a repetitive strain due to overuse, causing micro tears in the plantar fascia. Furthermore, be aware that while you might think you have plantar fasciitis from pain in the region, it mightn't be that at all. For instance, nerve entrapment can commonly lead to misdiagnoses of musculoskeletal disorders because when a nerve gets squeezed, it can radiate pain to the surrounding area. For plantar fasciitis, tarsal tunnel syndrome, where the posterior tibial nerve gets compressed as it passes through the tarsal tunnel, is one example. Here are other differential diagnoses for the condition as per physiopedia.com. Overall, this only goes to show the importance of getting evaluated by a medical professional for more transparency into what's actually going on, and accordingly the best course of action in managing the condition. Next, let's discuss several evidence-based strategies used in handling the condition frequently. The good news is the vast majority of patients report treatments that don't require surgery, like the ones we're about to go through, to be enough to help the condition. The bad news, though, is that sometimes they may take people with severe plantar fasciitis anywhere from 6 months to a year to see meaningful improvements. Highlighting again why you should seek a proper evaluation and regular checkups with a relevant medical professional to make the path to recovery as short as possible while doing it safely. The most common way used initially to help the condition is through a period of rest alongside anti-inflammatory agents such as ice packs, heat, and NSAIDs. But remember earlier when we mentioned that plantar fasciitis isn't as related to inflammation as historically thought? Because of this, taking this approach alone most likely won't be enough to resolve the condition. Still, it may provide some relief. A strategy we advise, which might seem obvious, is to cut back on how much activity you're doing. Not entirely, of course, since moving is essential for our physical and mental health, but to try to find a more manageable level. For example, whether you're an avid walker doing 10,000 steps or an endurance runner doing 10 miles daily, try cutting the duration and/or frequency of the exercise in half and see if you're able to reduce the irritation while still being able to keep a good amount of your physical activity. Alternatively, you can try switching to types of exercise which are lower impact, like swimming or using the elliptical machine. Another method of helping plantar fasciitis is exercise therapy. Numerous studies have suggested that calf stretching with the knee being kept straight is beneficial. The rationale behind this is that because the calf inserts into the Achilles tendon, and since there's some continuity of connective tissue between the Achilles tendon and the plantar fascia, then stretching the calf may have a positive knock-on effect in reducing tension in plantar fasciitis. At the same time, limited dorsiflexion, the action of raising the foot up toward the shin, has been identified as a risk factor for the condition, of which calf stretching can improve. It's advised to stretch the calf for 3 minutes at a time, 3 times per day, or do it for 5 20-second reps twice daily. Additionally, stretching the plantar fascia itself can also be helpful. It's done by crossing the affected foot over the opposite thigh, placing the fingers across the base of the toes, and pulling the toes back toward the shin until you feel a stretching sensation. One study showed that out of 66 patients being treated for plantar fasciitis, 77 reported no limitation in recreational activities, and 94% reported a decrease in pain at 2-year follow-up from using the plantar fascia stretch. Strengthening then has also been shown to be effective for managing the condition, even as good as plantar-specific stretching for pain and improvements in function, according to one study. So combining it with the stretching mentioned above is a no-brainer. It's recommended to do heel raises on one leg with the toes lying on a small rolled up towel, like shown in the picture here, and it's best to do them on stairs for safety. Aim for 3 sets of 12 reps daily, going up for 3 seconds, pausing for 2 seconds, and coming back down for 3 seconds with each rep. If this is too difficult, you can use 2 feet until you are ready to progress to 1. Conversely, if using one foot gets too easy, add a backpack with books to increase the load. Furthermore, given all the talk about load's impact on plantar fasciitis and how much weight gain predisposes people to the condition, let's discuss weight loss as a treatment strategy. Indeed, few studies have investigated traditional weight loss impact on plantar fasciitis. But given that less body weight means less load on the foot, and hence less tension on the plantar fascia, positive outcomes from weight loss would sure make sense. Evidence supporting this can be seen from a study which included 163 people undergoing bariatric surgery who had previously been diagnosed with plantar fasciitis. The results showed that when the average BMI reduced from 45 to 35 following the operation, 90% of the patients reported a resolution of plantar fasciitis and its related symptoms. Needless to say, we aren't advising bariatric surgery as a treatment strategy for managing this disorder. Still, this data indicates how much traditional weight loss could aid the problem. Now, you might argue, how are you supposed to lose weight if you can't even walk without pain, let alone exercise? Well, keep in mind that nutrition is 80% of weight management. So even if you are restricted functionally, you may still obtain substantial benefits by getting your eating habits in line. If you are interested in undertaking our evidence-based and results-backed personalized plate weight management program, please click the link in the top right-hand corner of the video or follow the link in the description. Finally, outside of these traditional methods of managing plantar fasciitis, there are also several passive modalities available. One review suggests that radial shockwave therapy, intracorporeal shock therapy, and non-invasive interactive neurostimulation are best. Yet keep in mind that heel pain is a consequence of the condition, not a cause. So if you only do things to help pain alone without addressing underlying causes like excess activity, weight, suboptimal biomechanics, and plantar fascia load capacity, it'll leave you prone to getting the disorder again, with it possibly being worse the next time around. Therefore, modifying your physical activity and carrying out the exercises outlined are still essential for an optimal prognosis. Is there anything else you think that we left out worth mentioning? We'd love to hear from you in the comments section down below. Additionally, if you're new here, make sure to like and subscribe to our channel. So that has been our video. Thanks for watching, and I'll see you next time.